to this story now. A report by the Health Ombud Emeritus Professor Taole Mokoena paints a bleak picture on the state of Gauteng hospitals. The annual report, which was presented in Parliament last week, found that the province continues to have more complaints by far, whether this is taken as absolute figures or as per population size or indeed the number of hospital beds available. Professor Mokoena joins me now for a brief look back at his presentation to Parliament when he presented that annual report. Professor Mokoena, good evening to you, and thank you very much for your time. I'd like to start off with the key outcomes of your report. What stands out as matters of concern for you?
Thank you very much, Taole, and thank you for your audience. What stands out is that the majority of complaints are actually, to us, what we can describe as minor or trivial. But of course, to the people that do place the complaints, they're not trivial to them. But what we consider serious amount to only 10% of the cases. And of that 10%, only 2% end up being investigated. Yeah. Why do we say that only 2% get investigated? Is that according to the classification, only 2% of cases have resulted in serious injury or even death of the patients on whom the complaints are being placed.
Yeah.
And that the deaths are not related to their original disease, but rather due to the treatment that they received or did not receive.
That is quite serious, Professor. Are you at liberty at all to tell us the nature of this 2% which resulted in deaths?
Well, most of them, let me not say most of them, all the serious complaints, they span the spectrum of healthcare. But what we consider serious, not in terms of gravity, but rather in terms of their impact to society, are complaints that pertain to the deaths or complications of mothers or newborn children. In other words, perinatal complications and deaths.
And have you been able to establish whether the health facility or facilities concerned have taken up these matters in order that they be addressed? Because if not, they surely will be a repeat.
Sadly, these complaints, they are spread throughout the country, and therefore there are not many that are repeat instances, but rather they occur across the country. We are in the process of trying to drill down the actual areas where we could say there are nodes of complications. But from preliminary results that we do have, is that we cannot, at the moment, pinpoint the actual places, if there are any. What we do see is that they occur both in public service, in other words, public hospitals, as well as as well as in private hospitals. As your introduction has said, Gauteng seems to bear the brunt of the lot for reasons that you've already indicated.
Yeah. And let's drill down further to those complaints, Professor, because the Gauteng province has been somewhat under the microscope. I'm not neglecting the Eastern Cape, I'm not neglecting the KZN province, but what for you is problematic or most problematic about Gauteng health facilities? And let me be specific. Is the problem more pronounced in public health care, or is it a combination of both public and private?
By far, the public has got most complaints. Now, I must hasten to add that by the time affected individuals come to us, they would have dealt with the institutions concerned, and that when they come to us, they are already not satisfied with whatever explanations or of the difficulties that has happened at the institution, and therefore, this apart from the actual gravity of the complaints and the instances that have resulted in the complaints, there's also the question of the human communication and redress that people may or may not get at the institution, at the primary institution.
Yeah.
Now, I say that because the private sector, in the main, has got a better PR exercise that the public sector does not have.
Yes.
Now, to go back now to the question that you did ask, I've done investigations outside my current position, and what we have recognized or discovered, not in relation specifically to the complaints that come to the Health Ombud's office, where I am now, is that the public sector, the management is actually in disarray. I know that's a very strong characterization. However, the disarray can be seen from the fact that of the 5 provinces that I had investigated 5 years ago,
Yeah.
and I've been investigating now, one of the major reasons is that the senior management in the provinces are acting. And acting managers have got very little authority on the people that they are leading, precisely because in the hierarchy, they are at the same level in the hierarchy as the people that are being investigated.
All right.
Or are being accused.
Professor, I want to pick up on the leadership question, because you're saying that people who are in acting positions, they don't necessarily have power over the people they lead. And I want to give us a living example. Tom London, a patient in one of Johannesburg's hospitals, he has become the poster child of what a patient experiences in the public healthcare sector. And with that in mind, when you look at the majority of the complaints, you have said 10% of these cases are serious, but some people may deem it trivial. because perhaps they were not the ones experiencing it. Do you find that out of the majority of these complaints, they are clinical in nature, or it's got to do with staff attitudes?
Let me just answer this in the following manner. I did say that the majority, which is 90%, in our view, are minor, and that 10% are serious. And the 10% that is serious is actually clinical in nature. Some of the what we call trivial are lack of communication between patient and doctor.
Yeah.
That the actual clinical outcomes are actually what one would expect under the circumstance of the particular clinical problem. Now, going back to Tom London, whose actually name is Thomas Holmes, we are currently looking at that. In fact, this week is the 4th week that we've been looking at his complaints, and I myself have interviewed Tom Holmes, and then have interviewed some of the staff that were involved, and I cannot at the moment pronounce on what we have found in terms of that particular incidence of Tom Holmes.
Yeah.
But the issues that he brought up about infrastructure, it is real. And the investigations that I already alluded to that I've done in the past and that my team are doing even currently, they do show the breakdown of infrastructure, both in terms of the hospital itself, as well as the breakdown of equipment that is necessary in the clinical execution by doctors.
Okay.
Now, you asked about the attitude of the professional staff. In the main, I think that most professional staff are empathetic, and they're very serious and dedicated to their work. However, there's a major shortage of staff in all categories, from nurses through to clinicians, doctors, and they get burnout. And some people, we're not all the same. They lose their temper, and they may behave in a manner that is not acceptable or unbecoming. But I must say that these are the minority rather than the majority.
Yeah. All right. Professor, I think using that example of Tom London, I want to conclude the conversation on this point, because Tom London, or Thomas Holmes, that's his actual name, he ended up in a private health institution because people banded together to crowdfund so that he gets help in a private health institution. What kind of picture does that give the public hospitals at a time when the government is pushing for the national health insurance to be implemented?
Thank you for asking that question. I think we must de-link Tom London's incident from the national health insurance. If we talk about Tom London's incident, is that Tom London actually, not only in the videos that he placed in the public domain, but also during our investigation or interview with him, he did not have major issues with the clinical aspect of the treatment that he did have. I said to you, I'm not at liberty to talk about Tom London in general, but I just wanted to underline this one aspect. That
oh no,
that he did not have. Now, clearly, the public sector is treating 80% of the population, but it has got 20% of the resources, and therefore it cannot get to the treatment in a expeditious manner.
All right.
Whereas the public sector, and you can see that the ratio is reversed, it can do it can get to the majority, maybe not as quickly as the private is doing now, but certainly quicker than what the public is doing now.
All right.
Now, what NHI is trying to do is to level the playing fields. Maybe, I say maybe, if the NHI is executed in a manner that theoretically it can do, it can improve the access of the majority of care.
Professor Mokoena, I'm terribly sorry. I'm terribly sorry that the line to you just keeps breaking badly. But I want to thank you very much for your time. And I'm sorry that we're ending on this note when you were really getting to the crux of the matter. But I want to thank you very much for your time. Professor Taole Mokoena is the Health Ombud, talking to us about the state of healthcare in the country.